Cancer in India is no longer an individual problem. It is a national emergency. Every year, lakhs of families in India is receiving cancer diagnosis that changes their lives forever. So, the real crisis today is not just the rise in number of cancer patients. It is the even faster rise in the cancer-related deaths. This is a warning sign that something is deeply very wrong in India. Either it is detecting the cancer or curing the cancer, or it is treatment or managing cancer. So let us begin with the actual numbers. Welcome to Youturn, and this is Nandini Madheshwaran. According to the written reply given in the Lok Sabha on December 5th of 2025 by the Minister of State for Health and Family Welfare, Pratap Rao Jadhav, says that the cancer burden in India has been steadily increased over the last decade. In 2015, the number of cancer patients was about 13.9 lakh, whereas in 2024, this number has increased to 15.3 lakh. That is 10.4% increase over the last decade. On its own, the rise is worrying. But what is even worse is the cancer-related deaths. In 2015, 6.8 lakh Indians died due to cancer. But in 2024, this death has been increased to 8.7 lakh. This is a 28.7% increase of cancer-related deaths over the last just 1 decade. In simple terms, cancer deaths are rising almost 3 times faster than the cancer cases. So now consider this crucial indicator. In 2015, the number of new cases, the ratio of number of new cases and the number of deaths was about 49%. That means roughly half of the diagnosed eventually died from the disease, which is also a maximum number. But by 2024, this ratio has been increased to 57%. This tells us one harsh truth. The higher proportion of cancer patients are dying today than they were in 10 years ago. This is not because cancer was suddenly became aggressive. This is because the system itself failed to detect and treat cancer on time for the people. Globally, the picture is equally disturbing. According to the data of International Agency for Research on Cancer, India ranks 3rd in the world after the United States and China in terms of number of patients affected by cancer. And also the Lancet study says that India is the 2nd largest in Asia in terms of number of people affected by cancer. In 2024, the national average shows about 109 new cancer patients per 1 lakh people. This national average hides some of the regional differences. So in some states, the cancer cases are even more heavier. For example, if we take Kerala, it is recorded about 170 cases per 1 lakh people, and Karnataka reported 139 cases, whereas Tamil Nadu reported 128 cases. So highly urbanized states and coastal areas face high cancer incidence, possibly due to lifestyle changes, pollution and longer life expectancy. At the same time, Uttar Pradesh and Bihar shows the lower incidence rates like 93 and 90 per 1 lakh people respectively. But this doesn't mean that the problem is smaller there. Because of the massive populations, the absolute number of cancer patients is extremely high there. So Uttar Pradesh alone has 2.21 lakh cancer patients, whereas Maharashtra has 1.28 lakh patients and West Bengal has 1.19 lakh patients, whereas Tamil Nadu has 98,386 patients. So the cancer burden is not just concentrated in some states. It is widespread across the country, affecting both rural and urban areas. So the biggest question comes here is, why the cancer death is increasing more than the cancer cases? The first and biggest reason is the late detection. Usually in North America and Europe, most of the cases will be identified in stage 1 and stage 2 itself. When it is identified in stage 1 and stage 2 itself, the treatment will be more effective and less expensive, and the survival cost is high. But in India and other Asian countries, most of the cancer cases are identified only in the stage 3 and stage 4. At these stages, the cancer has been already widely spread through the body and the treatment becomes so complex and expensive, and the survival rate drops sharply. But why does this happen? Because the screening is very low and uneven here. Successive National Family Health Surveys shows that in India, cervical and breast cancers make up nearly 2/5 of the cancer cases that affect mainly women in their reproductive years. So Indian government suggests that women over 30 years should definitely take the test of cervical and breast cancers. Under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the government planned to convert 1.5 welfare and health centers into screening points for diseases like cancer. But the reality hits very different. If it had been fully implemented, the early stage of screening could reach every villages and small towns across the country. But the reality is very different. A Niti Aayog report reveals that only less than 10% of this has completed the early stage for screening. This means that millions of people are identifying that they have cancer only after symptoms occur. The second major reason is the lack of treatment infrastructure. The World Health Organization says that every 2.5 lakh people should have one radiotherapy machine. But India's reality is very different and it hits hard. But India has only one radiotherapy machine for every 15 lakh people. Nearly 70% of the Indian citizens are living in rural areas. But 95% of the cancer centers or cancer hospitals are located in cities. So this creates a cruel imbalance. Every rural patient should have to travel hundreds of kilometers to reach the hospital or to reach the center for their chemotherapy or radiotherapy or diagnosis. Many cannot afford this. Many cannot afford the travel and many give up their treatment halfway, and most of the people will not start their treatment at all. The third major reason is cost. In India, cancer treatment is very expensive even in government hospitals. On average, the hospital-based treatment costs about 61,281 rupees. So for middle class people or poor people, definitely it is unaffordable. As a result, more than 75% of the cancer treatment costs out of their pockets. In medical terms, this is called as catastrophic health expenditure. The World Health Organization defines this as a situation where medical expenses exceeds more than 40% of the household's income. Studies also reveals that 1/3 of the Indian families spend most of their half of the annual income to the cancer treatment. So this automatically pushes the families into debt. They sell all their lands and jewelry and they reduce the cost for their food, lifestyle and housing. In 2014, only 14% of rural Indians and 18% of urban Indians had any form of health insurance. Even today, insurance coverage for cancer treatment is very limited or inadequate. Many specialists say that early detection alone will not cure cancer and it is not enough. In an article published in the Lancet, cancer expert Bhavna Sirohi along with the researchers from the Harvard University and the researchers from Toronto argues the complete restructuring of cancer care. They emphasize the need for stronger cancer data systems and trained human resources, affordable and accessible healthcare infrastructure and integrated local healthcare systems. Their conclusion is very clear. Detecting cancer without giving affordable treatment will not reduce cancer deaths. And finally, we must talk about the spending of cancer treatment. Despite the growing crisis of cancer, in the 2023-24 union budget, the union government has increased only 1.9% to healthcare. At a time when cancer cases and cancer patients are extremely increasing, this level of investment is dangerously inadequate to the people of India. If India truly wants to save lives from cancer, it must strengthen the primary healthcare first and it must expand the cancer treatment center national-wide and make sure that infrastructure is done properly and reduce out-of-pocket expenditure and ensure that rural India is not left behind. So cancer is of course a deadly disease, but it is also exposing India's part where the system fails to support the poor, rural and vulnerable. Without urgent investment in early detection, proper treatment and investing in public health care, this crisis will definitely not let down. The numbers will keep on increasing and so will the deaths. Thanks for watching and see you in the next video.